Okay. So I'm suggesting that while the diagnostic of disorders are useful in medical setting and also for the purpose of getting insurances, maybe a better way is to reconceptualize mental disorder in terms of adjustment problem or transdiagnostic factors. So I'm suggesting that there are three set of adjustment problems. Number one, dealing with coping. Number two, dealing with relationship. Number three, dealing with meaning. Okay? The advantage of that transdiagnostic factor is that it avoids the stigma and avoids the arbitrary nature of DSM and identifies the common factors responsible for both mental health and human functioning. So again, we talk about immunotherapy, dealing with healing as well as flourishing, because we focus on the common factors. Yeah. Now, for example, the adjustment disorder, if you are longer than 7 months, then you're sick. It's very arbitrary. How many months is considered as the limit? Okay? So in my early career, I spent a lot of time working with another psychiatrist doing stress medicine. Okay, stress medicine. So we are trying to find out what is the best way to help people to cope better in life. Okay. So this model is the result of such research. So I developed the resources congruence model. Okay. First, resources. Why you have stress, why you freak out, have anxiety and depression, because you do not have enough inner resources. You have no friend, no money, no health, no purpose, no plan. When you have no resources, then what? Then you have empty shell. You won't have empty shell. You're not strong enough to bear the burdens of being. When anything bad happens to you, you're nothing to cope with. You collapse. You panic. You go to seek escape through addiction, or you kill yourself because inside you is empty shell. All those years you spend in eating, drinking, having fun, you never develop those resources. A social network, a philosophy of life, religious faith, emotional intelligence, all those things take time, take effort. You can't cope, then why? You've got nothing inside you. Your car in trouble, got money in the bank, no problem, buy a new car. But you have no money in the bank. So I have a client working in the bank. So she understands that. I say, no, you know what? You want to be rich? If you put some money in the bank every day, when you're a teenager, put $5 a month every month. Compound interest. Calculate for me how much money you have. A teenager, you put $5 a month every month without stop. By the time you're 50, how much money do you have? Eh? Lots of money. Maybe you're a millionaire. Just $5 a month. Over 50 years. The same idea is with psychology. If every day you build something, you improve yourself. Take care. Every day you improve yourself, You learn something new. You learn some new habit. Learn some new strength. Exercise your faith. Exercise your physical body. Try to regulate your emotion. Acquire new knowledge, a new skill. If every day you put money in your psychological bank, every day, boy, you're very rich. It doesn't come by magic. It comes by building it every day. So by model of coping, it's called proactive coping. That you building a bank, building our immune system. Remember I talk about relationship, meaning, and faith. The three most important things, right? You cultivate your faith, cultivate relationship, cultivate meaning every single day. By the time you're old, then you're able to face the biggest challenge in your life. That means facing death. You're not able to face death if you haven't prepared yourself. It takes a lifetime to prepare yourself. It takes a lifetime to build up your inner resources. Okay? That's the first part. The second part is congruent. In other words, your coping skill, your coping behavior must match the demand of the situation. You don't use a sledgehammer to crack a nut, right? They overreact. So if you have enough resources, then you also need a practical wisdom to decide the situation. What behavior most effective? Sometimes maybe persuasion, sometimes maybe confrontation, challenging, sometimes disengagement, sometimes forcing your way through. So different situations call for different responses. So any question?
So it's almost 12.
Just answer one question before I go. Any question about the resource model? Any question about the resource? About putting money in every day? Do you like that idea? Put money in your bank every day. Okay, no question, then we could eat now, okay? Eat every day,
Okay. So lunch is in 1424, and please be back at 1.